Care Center has been open for 5 years. We see a wide variety of patients. They come from all over the area as well as from Vermont. They cross the lake to come over to our center. Anyone with a non-healing wound would qualify to see us in the office for wound care. The typical wounds that we treat in the Wound Care Center are diabetic foot ulcers, venous and arterial ulcers. We see pressure injuries, burns, surgical wounds, traumatic wounds, and then atypical wounds as well. The first visit in the wound center often takes a little bit longer because we do a thorough assessment and history of the wound. After that, the appointments are a little bit shorter, but each appointment, the wound will be cleansed. We do measurements, we take pictures, and then we will do any debridements if necessary, and then redress the wound. To treat these wounds, we often do compression wraps, we do casting to provide offloading, we do wound vacs and cellular-based tissue products as well. It's really hard to provide a patient with an answer for how long it'll take to treat their wound since there's a variety of other contributing factors, so we just take it week by week and kind of progress from there. Every visit, the nurse provides education to the patient so they can treat their wounds at home, and sometimes patients often qualify for HCR to get home care nurses while they're not in the office. What I would want patients to know is that every person that walks through the door, their care is individualized to them. No two people heal the same. So every time you come in, your care plan is updated and we treat you as how you're progressing. Hyperbaric oxygen treatment is a therapy that we sometimes use as an adjunct to local wound care. The chamber is 100% oxygen and it's pressurized. Patients usually are in the chamber for about 2 hours a session, 5 days a week. The chamber helps provide oxygen to the wound as well as help with angiogenesis, which is the creation of new blood vessels, and both of these things help heal the wound. Typical people that qualify for hyperbarics are diabetic foot ulcers that are a Wagner grade 3 or higher, soft tissue radionecrosis, or failed flaps or grafts that aren't healing. And before patients go through the hyperbaric chamber, we get prior authorization from insurance. Each insurance is different, so a patient should check with their insurance to see if general wound care is covered before they come to their appointment. We don't require referrals. Patients can be self-referred, they just have to call the office.